SNV1521 is a novel PARP1-selective inhibitor, and first data were presented at ESMO 2025. The study demonstrated that this novel PARP1-selective inhibitor has an improved tolerability profile compared to first-generation PARP inhibitors. And also in terms of response, we observed that some patients, especially with alteration of the homologous recombination pathway that were not pre-exposed to PARP inhibitors, achieved very good benefit on this drug. And in particular, I believe that the safety profile of SNV1521, together with this preliminary sign of activity, allow for further development of this drug, either as monotherapy or in combination therapy with novel agents, including antibody-drug conjugates, chemotherapy, and targeted therapies.